answers the phone when people call into our department, I can say, I have spoken to a number of people in this room, and you guys are asking hard questions, and I really appreciate that. It helps keep us on our toes and keep us moving forward. So thank you for your input. Next, I'd like to introduce Michael Scott, who's the Division Director in the Division of Waste Management. He's going to give a presentation about some of the groundwater issues and the data that we have.
Good evening. Thank you everyone for coming out. As Julie mentioned, I'm Michael Scott, Director of the Division of Waste Management. Our particular division has been the lead on the groundwater investigation, working with the information Chemours consultants have been providing regarding private wells that have been impacted. And I want to share some of that updated information with you this evening. Next slide, please. This evening we want to touch on several different aspects, primarily to include an overview of the state and federal resources currently involved at this site and around the region, the Lower Cape Fear. We want to touch on the latest surface water and groundwater monitoring results so that you're informed, so that you have the data that we have. We want to talk about some of the next steps associated with groundwater and also discuss alternate water supplies, which I know is a big topic of interest. We also want to discuss information on air emissions from the Chemours Fayetteville Works facility and also provide some additional information that Secretary Regan alluded to on the enforcement update. And conclude our presentation this evening with specific information from the Department of Health and Human Services and the overview they will provide. Next slide, please. When we're looking at the particular issue at hand regarding the Chemours Fayetteville Work facility and the contamination associated with that facility is a collaborative effort. And this is the list of the resources involved. This evening you have resources from the Division of Water Resources here tonight with you, the Division of Waste Management, who I represent, the Division of Air Quality, and also, as mentioned, the Department of Health and Human Services. In addition to that, we have a strong collaborative relationship with our federal resources, the Environmental Protection Agency, their immediate staff and Research Triangle Park, and also their staff throughout the Southeast region that makes up Region 4. We also have continued networking and collaboration with Bladen and Cumberland County Health Departments and also the boards of commissioners. And I appreciate them being here this evening. Next slide, please. So areas of focus, we know what's on your mind, but we definitely want to make sure that you know that we know that. Our focus is to address the needs of the surrounding communities. These particular impacts to private wells, the concerns you have regarding the emissions from this plant, and to share information related to that. As a state agency, the Department of Environmental Quality, we also want to serve as a conduit of information for the community and local partners to address concerns. But also we're working actively. Staff are with us here tonight to fully assess the environmental impacts associated with fluorinated compounds in the environment, but also further the knowledge base regarding these compounds through the collaboration of different state departments, and as Secretary Regan mentioned, the newly created Scientific Advisory Board, which is a great group of individuals from universities and other disciplines with a great deal of expertise to further our knowledge base on these particular compounds. Next slide, please. Touching on some of the specific data that we said we would share with you this evening, it's important to note that mid-summer, when we discovered that there was groundwater contamination at the Chemours plant, the groundwater beneath it, within their on-site monitoring wells, we knew we needed to expand the scope out into the community. This first round, or what we often refer to as Phase 1, was a radius from approximately the center of the Fayetteville Works facility out to 1.5 miles from that center. When that private well sampling Phase 1 was conducted, we ended up seeing that there were unfortunately 51 private residential wells that had the compound GenX in them. Above what we're going to talk about more this evening, the provisional health goal of 140 parts per trillion. There was some good news in that there were wells within that particular radius, 35 of them, that had no detections for this particular compound, and 55 that were less than that provisional health goal meaning that it was safe to consume the water. Next slide, please. Knowing that GenX had been discovered in private wells and also reaching the reality that we didn't know the full extent of the contamination in private wells, a second phase was initiated, which you see here on this slide, phase 2. In that particular phase 2 sampling effort, we almost finished all of the data that we're quality assuring. Chemours is doing that sampling through a consultant that they're utilizing by the name of Parsons. That data comes into the state to us in Raleigh, and we have staff that quality assure that make sure that that data is accurate. I was asked this evening, do we believe these results are accurate results? And I think that's an important question. It is a certified lab, a certified consultant that's collecting the samples, but we also have state agency staff that are reviewing those results. We do have in this second round of sampling 64 wells that are unfortunately above the provisional health goal that we'll talk more about this evening of 140 parts per trillion. We also had a good portion of wells that had no GenX contamination in them, 55 wells. People often ask, well, why is that? Why do you see some wells that are contaminated, some that are not? We don't have all the answers at this time. We feel there is some correlation to well depth. A lot of the wells that are contaminated are less than 100 feet deep. Wells that are deeper than that, we're typically not seeing this compound above the provisional health goal. And we also had 89 wells that had detection of the compound, but it was less than that safe drinking water level. Next slide, please. We are trying to make sure that we're providing as much information and trying to work on this daily to disseminate information through our Department of Environmental Quality website. And one thing that we get asked for almost weekly are the maps. And these are GIS maps that we're creating that provide a good visual image of where the contamination has been discovered. So if you look at this particular map, the Fayetteville Works facility is in the center of the map, kind of a white square area. If you draw your attention to the red and the orange polygons, those are the sites that have been sampled that have levels of this GenX compound above the provisional health goal, okay? We have some areas that are blue, as I've given you some of the data. Those are non-detect areas for this particular compound. Next slide, please. This is the same map, just showing the southern view, mainly Bladen County, of the particular private well sampling efforts. Once again, the red and orange polygons are showing you wells that have been sampled that have this compound in it that are above the provisional health goal of 140 parts per trillion. It also is showing us that there are areas where we need to continue to expand our sampling efforts. Next slide, please. So as I've shared data with you, and I know we're going through this quickly, but as I've shared data with you regarding 2 phases of private well sampling, this particular slide shows you a blue outline. If you'll see, there's a yellow line and then a blue outline going over to the east from the Cape Fear, farther north and also south. What I will share with you this evening is that after 2 rounds of groundwater sampling, we have reached the decision that further sampling is needed, and there will be additional private wells that will be sampled, and those wells will be within the blue line that you see on this particular image. So as you look east of the Cape Fear River towards what I often call the Carolina Bay, you know what that looks like, that oval image on the screen, you'll see where this additional sampling effort is going to be. Next slide, please. In addition to private well sampling, Chemours is doing the vast majority of that. The state of North Carolina is sampling private wells also. We are spot checking